intrauterine, situated in, used in, or occurring within the uterus, involving or occurring during the part of development that takes place in the uterus.
Dr. Sanders, thank you so much for joining us here today on HealthWise. What is an IUI procedure?
An IUI is an abbreviation for intrauterine insemination, and that is a procedure whereby an OBGYN would assist a couple who is having trouble with fertility in attaining a pregnancy due to certain factors.
Is there a particular candidate that is more suited for this procedure?
Yeah, it's actually sort of detailed. We first start off with a couple that comes in that have been trying to get pregnant or achieve pregnancy for a certain amount of time, usually in the range of 6 months to a year, and they've gone through various workup, and when the common denominator has been approached, we seem to think that it may have to do with either a male problem or a problem with the cervical mucus and the ability of transport across this median.
What type of workup are we talking about here? Is it a workup that takes several days? Do you test both the male and the female candidate? How do you go about that?
Yeah, usually in the initial workup we start off by, the easiest thing to test in the beginning is testing the male and seeing if the sperm count is adequate and if the forms of them are not abnormal or normal and the motility of them are good. That's just very easy to do right off the bat. The next step would be to look at the female. It's much more involved. We start off with usually with the basic laboratory evaluation to make sure there's nothing wrong with hormonal processes, and then we look at such things as anatomical, looking at the ovary, the uterine cavity, the fallopian tubes, and the cervical barrier. So once we get all of this together and we determine that the woman is truly ovulating, that the male is not azospermic, meaning that there's no sperm, and they're having trouble getting pregnant through the process of evaluating all this, then we come to some conclusions on what the exact nature could be or cause of the infertility problem.
Now, once you qualify a candidate for this procedure, is timing important to have it done? How long does that take?
Yeah, it usually, well, the evaluation to determine whether there's a cervical factor or a true problem with infertility usually takes on average a good month or 2 months of evaluation, with approximately 3 to 4 office visits depending on what we decide to do. In order to say that it's a cervical problem, you pretty much have to decide that everything else is working okay as far as ovulation, that the tubes are open, and that there is a sperm count present. And once we have all that, within about I would say a month to 2 month time frame, then we can start with that, the process of intrauterine insemination if necessary. The actual procedure of intrauterine insemination is based on timing, because we do have to make sure that it is within the immediate time of ovulation occurring, and we have to perform the procedure within a short interval of time, usually within 12 to 24 hours of ovulation occurring.
Is this an in-office procedure? Do you go home that day? Do you have to get into the hospital for this?
Actually, it's a very easy procedure as far as the entire process. What we do is we have to collect the semen, and we use a type of a technique called a swim-up method, whereby we put it in a test tube, we put a culture median on the top, and the healthy motile sperm get into this layer of median, and then we withdraw that into a little plastic pipelle, and then we insert that into the uterine cavity, bypassing the cervix completely in the office. And it's the pipelle that we use is very thin. It's probably about the size of, if you will, an ink pen cartridge. The very tip of it, how small that is, that's about the size of it, and it usually passes through the cervix with relative ease. And then we inject the sperm or the sample into the top of the uterine cavity as the egg would be coming down through the fallopian tube. So it's all done in the office. It doesn't require any hospitalization at all.
Are there any risks associated with the procedure?
Risk to damage of uterus or anything like that, there's very minimal risk. I mean, that's why it's done in the office. We do types of procedures like this all the time. The only risk that's really out there, if you read any information about it or anything, has to do with the fact that in some instances, which we don't really do a whole lot of around here, you can get sperm donors if the husband truly has no sperm count. And that has some risk of infection processes such as hepatitis and HIV and stuff like that. But we don't really have that to offer too much around here. It's mainly in the big tertiary centers or big cities that you have that to worry about.
How often will you offer this procedure to someone? Is it something that they can just do one time, or can it be offered to them several times? And about how long does it take for them to find out if they are or are not pregnant?
Well, there's a point in the infertility process where the couple or the patient is going to become frustrated. And generally speaking, it seems like it's within about a 3 to 4 month period. Intrauterine insemination has been found to be effective only till about the 3rd or 4th month of attempt. And usually the 1st or 2nd month is when it's most highly effective. And then the 3rd or 4th month, there's still some advantage to going to that amount of time. But after about the 3rd or 4th month, it not only becomes frustrating for the couple, but it also probably is less effective overall if it hasn't worked to that point.
Is there anything else about the intrauterine insemination that you think people should be aware of, or any reasons why it's important to people who are possibly trying to get pregnant?
Well, the main thing that they need to be aware of as far as intrauterine insemination is that it's not like we're trying to attract a large population of patients on this. It's really a select population. In the process of all that, we do work with other sources of infertility, but in reality, it's probably about 10% of our infertile patients that have some type of cervical factor problem. So that's the main importance to it. And the other thing is that if it is effective, and that is the true problem, despite whatever else we try and do, the intrauterine insemination is going to be the only way for the patient to actually get pregnant. So it is important in that, because it can be very frustrating undergoing clomiphene fertility cycles and all these other tests if in reality cervical is going to be the biggest problem. A lot of patients know about having to drink Robitussin or mucus thinning type liquids, and the reason we tell patients that in general is to try and thin out cervical mucus and allow stuff to get through that barrier. It's sort of like the cervical mucus is, if you will, if you would think about when you watch all your television shows and you see people in the rivers trying to get the gold out of the little sifting device, and after they get everything out, they have the gold sitting on top. That's sort of how this works. The cervical mucus will break out everything that's bad and allow just the good stuff to get through. And that's sort of what the intrauterine insemination does if there's a problem in that process.
Are there any other procedures that should be done in conjunction with the IUI?
Yeah, the main things that we do as far as inpatient or outpatient procedures when we're looking at anatomical problems with the uterus and fallopian tubes, one of the procedures that we do in the radiology department with the obstetrician and the radiologist present is something called a hysterosalpingogram. And that is the process whereby we inject a catheter very close to the size of an intrauterine insemination catheter into the uterus. We inject dye under fluoroscopy, where we're taking an X-ray on a continuous basis, and we determine whether the dye flows through the fallopian tubes to determine if the tubes are open. And that's usually done within the beginning stages of the infertility workup before proceeding with the intrauterine insemination. One thing that we've not touched on yet has to do with a laparoscopy. A lot of causes of infertility have been related, or in the public have been thought of as being endometriosis and other problems within the abdomen near the pelvis. And with a outpatient procedure whereby we place a scope in the belly button and look around in the abdomen for problems, we can sometimes diagnose such things as endometriosis or adhesions related to previous surgery having to do with blockage of the tubes. That usually is done, and within that day they can go home. And it's usually a step that by the time the infertility workup and the intrauterine insemination process is completed, we will have performed all of these procedures.
Is the IUI covered under medical insurance?
Under some insurance plans, there is a code that we can submit to the insurance company where they will pay. Through the years of practice that I've been here, it seems like there are some insurance companies that do, for some reason, cover infertility, and some that just don't. But it's not a very costly procedure. I think a lot of the problems that when you talk about intrauterine insemination that people think of is they think that it is the bigger test or a procedure known as in vitro fertilization. And that's not really done in HOMA because of lack of equipment and thereof, but in the bigger cities it is done, and it's quite costly. So this is a much less expensive process to undergo before moving on to this further evaluation and more testing that would need to be done.
And is this a process that's widely used in this area?
Intrauterine insemination is not used too much in HOMA at this point. I went to a conference recently, and it seems like it's not been in the nation being used on a wide basis, but it's becoming more effective because of the products that we can purchase have become a lot less expensive and a lot cheaper for the manufacturers to produce.
Dr. Sanders, thank you so much for joining us here today on HealthWise. We hope we've provided you with some beneficial information. Stay tuned to HealthWise for more.